No, that depends upon when her lining forms. That depends upon her lining. And embryo transfer is saying, no?
Yes, sir.
It depends upon how well she is making her endometrium. When endometrium becomes good, more than 8.5 or 9, that's the time when we start planning her embryo transfer. Which day has got no concern.
No, sir, not like average sort of day, sir, cycle.
In my practice, personal practice, I give 4 days of any estradiol valerate, 2 milligram BD for 4 days, and then I give 2 milligram TDS for 8 days. So I give 2 milligram BD, I get 4 milligram per day for 4 days, then I give 6 milligram per day for 8 days. And in case when I call them on day 9th or day 10th of estradiol. In case I find that lining is okay, I normally carry out, they are ready in 12 days of estrogens. They are ready normally. If not ready, then you can continue, and maximum I go is around 3 weeks of estrogens. So many times you get stuck with around 7 millimeter of endometrium, then keep giving them estrogens. And that's a time when you can also add GCSF or some other thing like that. I do give them something like arginine sachets. I do give them sildenafil or ecosprin, but they are all empirical therapies. I give knowing it is empirical, but I want to do something more, so I do. But it is not recommended. I give sildenafil 25 milligram BD, 50 milligram.
So dose of sildenafil? So root.
What is root?
Root of sildenafil.
Vaginally only. So we give 25 milligram BD or 50 milligram daily. I do give, but I admit that they are empirical things. It is not the right thing to do as per the recommendation.
Sir, when do we have to stop giving sildenafil per vaginal? One day before the transfer or on the day of progesterone?
I transfer the moment her endometrium is ready. No, endometrium will come around 8 to 9 millimeter. I'll give it that day, then I stop. Because otherwise her vagina will keep leaking bluish thing, and cleaning is becoming a problem. So vaginal drugs I stop 1 day prior to the embryo transfer. And I do tell them when you come to me, please clean your vagina with water, so that otherwise we'll have to now remove everything and scrubbing everywhere. So otherwise you'll find that clumpy things are there. And I don't even give vaginal gels before embryo transfer. I add vaginal gels after the embryo transfer, not before that.
So gel or tablet, which is better?
Tablets are only dydrogesterone. Other sustained, the other progesterone macronized cannot be given orally. There's a contraindication. So we are giving them progesterones which are oral progesterones, and they are dydrogesterones. They can be given orally. And vaginal tablets can only be given after the embryo transfer has been done. Because before that they'll make the vagina messy. So I don't do that. I give them dydrogesterone 10 milligram TDS as luteal phase preparation, and then I also give them, in case I want to give them 2 supports, I give them progesterone which are subcutaneous. And after the transfer has been done, then it's up to you. I like to give 2 supports. I like to give them vaginal gels which are 8%, and I give them oral support. I normally avoid third support.
Injectable.
But I do give third support in case of a previous failure. There I break my rules. Then I give 3 supports. But I don't work on monotherapy. I give 2 therapies. In a failure case, I give 3 therapies.
Okay, thank you, sir. What are these?